Okay, well, good afternoon. We'll get started on our weekly update for September the 22nd. Mr. Zanoni has a schedule conflict and won't be here, and the judge has also got something that prohibits her from being here, but the two people that are key to be here are Dr. Byrd and Annette Rodriguez, so you'll get lots of good information. We do feel like, based on the information, we're continuing to make improvements. Our downhill trajectory on the graph is good. I think the governor's main focus is the number of hospitalizations. It is, we discussed with Ms. Rodriguez today in City Council, it is frustrating when we keep getting the state dumps on us. While we think we're doing good, and then all of a sudden they dump it, but when you realize that they go back, could go back as 3 or 4 or 5 weeks, and those people probably have already recovered from when those numbers were there. So I think that's why the governor is really beginning to focus just on those that are serious enough to be in the hospital, and those numbers continue to come down, which we're grateful for. So I'd ask our Public Health Director, Annette Rodriguez, to come and give us the numbers for today. And then Dr. Byrd from Texas A&M Corpus Christi will come and share with us his statistical insight and see what kind of a future he's forecasting for us. So Annette, if you'll come and share with us what you have.
El día de hoy el administrador de la ciudad no nos va a acompañar. Las cifras continúan mejorando localmente, pero es frustrante cuando el Estado nos entrega resultados de hace varias semanas y las cifras se ven diferentes a las actuales. Ahora la directora del Distrito de Salud, Annette Rodríguez, nos va a dar su reporte.
Annette Rodriguez, Public Health Director. I'm going to go over the COVID-19 numbers today for Nueces County. First slide. So the first slide you're going to see up here is the daily number of cases here in Nueces County. And I really like this slide because I've got a lot of calls last night about, what about these 200 numbers? Those are when you see the state sends us additional cases that are old cases, and so we have to report them to be transparent to the community, but we really need to be looking at these numbers. And so I like the 8 back in on the 12th, and the 8 again on the 17th, 7 days later, almost 7 days later. And then we saw 17, 19, 16, 37 cases, and then today, 20 cases. Next slide. So the next slide is the donut, and it basically shows you the number that are recovered in Nueces County, which is a great number of people. 19,342 people have recovered from COVID-19. So active cases, 521. So that's the number that we keep an eye on, because that number can actually infect other people if they don't stay home while they're sick, or if they're asymptomatic, stay home and isolate themselves. And we'll talk more about deaths on the other graph. Next slide. So this is the hospitalization graph. And what you see is from September 12th to today, the number's the same. So 78, it's gone up and down, but 78 September 12th and 78 again today. So people have come into the hospital and people have left the hospital. Hopefully a lot of people have recovered and have been discharged. So we're watching these numbers very carefully. They're in the double digits. It's going to be awesome when we can see these hospitalizations in the single digits. Next slide, please. This is the ICU patients. You kind of see the same thing in the 30s, 36, 35. You see it at 27. And here today, we're at 33 in the ICU. So we do know that people in the ICU, some will recover. We also know that there's a percentage of those individuals that will pass away. We did have 2 COVID-19 individuals that passed away today. And so that brings us to 470 individuals that have lost their fight to COVID-19. So our condolences to those families. This just shows the bell curve. It shows, early on, we were very low numbers, single digits, and then we peaked around July 14th. We had the most cases in July with over 11,000 cases in that 1 month alone. And then we've come back down, and so we're down here at this point. So the 7-day average, just for your knowledge, is 20. Every day for the last 7 days, 20. And this slide actually shows the same numbers that we've been talking about, but in addition, it also talks about the state numbers that they sent us, and then we have to put them back where the lab test was actually conducted. So if the lab was done back in April, we put the number back in April, and that's how it's depicted with the yellow part of the top of the bar. So just to show, it doesn't really change the shape of the bell curve, but it does add to our number of cases. And that's all I have for the COVID-19 report. For the health district, we will be having a drive-through tomorrow. So if you're symptomatic and you need to get tested, please call the 826-7200. Also, last week, the governor expanded the operation capacity to some businesses and services. Beginning this Thursday, September 24th, visitation options are expanded to eligible nursing, assisted living, and intermediate care facilities, home and community-based service providers, and inpatient hospice. Designated essential caregivers will be allowed to provide supportive, hands-on care to facility residents who do not have COVID-19, of course. Residents will be allowed to designate up to 2 family caregivers. These caregivers will be trained by the facility to allow them to enter the facility for a scheduled visit to the resident's room for a face-to-face visit. Caregivers will be able to touch their loved ones, but only 1 caregiver will be allowed in at a time. The caregiver must wear appropriately donned PPE and must test negative for COVID-19 within 14 days prior to the scheduled visit. Our vulnerable population continues to be a major public health concern, especially as flu season is coming up October 1st. The health district is advising all citizens 6 months of age and older, including those in long-term care facilities, to ensure that their residents get the flu vaccine as soon as possible. Flu vaccination is an important preventive tool for people with underlying medical conditions and older adults. The flu vaccine offers protection against the flu. Since COVID-19 and the flu will be circulating at the same time, in October, getting the flu vaccine is even more important to reduce the risk of getting severely ill from both COVID-19 and the flu. Remember your public health strategies by practicing the 3 W's: wear a mask, watch your distance, and wash your hands as often as possible. Don't touch your eyes, nose, and mouth with unwashed hands, and stay home if you are sick. Stay healthy, stay protected by getting your flu vaccine, and as always, stay informed. Thank you.
En las últimas 24 horas se han reportado 20 casos confirmados por el coronavirus. 19,342 pacientes se han recuperado por completo. 78 continúan en el hospital. 33 están en la unidad de cuidados intensivos. 521 casos continúan aún activos. Hoy se reportan 2 fallecimientos. A la fecha los fallecimientos totalizan 407 personas. Le enviamos el más sentido pésame a los familiares de los fallecidos. El día de mañana vamos a llevar a cabo la toma de especímenes por parte del Departamento de Salud Pública. Si usted cuenta con síntomas del coronavirus, se le pide llamar al 826-7200 para hacer una cita. La semana pasada, el gobernador amplió la capacidad operativa a algunas empresas y servicios a partir de este jueves 24 de septiembre. Las opciones de visita se ampliarán a centros de cuidados para personas mayores, así como de vida asistida, entre otros. Una persona designada por los familiares del residente podrá dar atención de apoyo a los residentes de las instalaciones que no tengan COVID-19. Los residentes podrán designar hasta 2 cuidadores. Estos cuidadores serán capacitados para permitirles ingresar a la instalación para una visita programada, a la habitación del residente para una visita en persona. El cuidador debe usar el equipo de protección personal apropiadamente puesto y debe dar negativo en la prueba del COVID-19 dentro de los 14 días anteriores a la visita programada. El Distrito de Salud está aconsejando a todos los residentes del Condado de Nueces mayores a los 6 meses de edad, incluidos los centros de atención a largo plazo, que se aseguren de que sus residentes reciban la vacuna contra la influenza lo más rápido posible. La vacuna contra la gripe ofrece una gran protección, ya que el COVID-19 y la gripe circularán al mismo tiempo. Vacunarse contra la gripe es aún más importante para reducir el riesgo de enfermarse gravemente. Recuerde seguir practicando las estrategias de salud. Use un cubrebocas, mantenga su distancia y lávese las manos. Ahora el reporte del Dr. Chris Bird.
Thank you. Good evening, everybody. My name is Dr. Chris Bird. I'm here on behalf of the COVID Task Force for the Coastal Bend area. Again, this week, you guys don't need to really see me. We made it so that the whole slide can be projected with the interpreter in the bottom corner. So we want to make sure that that's happening. Our objectives are twofold. One is to address public concerns about both COVID-19 and the interventions that are taking place to prevent the spread of COVID-19 or the rolling back of those interventions as it might be, like it is this week. Additionally, we're here to help enable evidence-based decision-making by our local leaders to try to help protect our community and keep us safe. So we have some new developments I think that everybody's heard about, but first we'll review some of the things that are in place. You're encouraged to stay at home if you can. Once again, this doesn't mean that you have to stay inside. It means you should be staying away from other people. Don't go to crowded places, especially indoors. 2, employ social distancing and face coverings. COVID-19 can be spread in aerosols, which means that 6 feet away isn't far enough to avoid aerosols that are being expelled. That's why we wear masks and face coverings to try to stop that. 3, self-isolate when you're symptomatic so that you're not spreading COVID. Also self-isolate if you've been exposed to somebody that has been confirmed to have COVID-19 until you get cleared by your medical professional. We have school restrictions, but these are slowly being rolled back. If I understand correctly, I think maybe next week there's going to be more face-to-face schooling in the Coastal Bend area. I think we're at 25% right now, 25% face-to-face schooling. At Texas A&M Corpus Christi, I know that there's some face-to-face schooling, but there's a whole lot of online schooling that will be taking place over the course of the semester. And then in terms of our rolling back these interventions, we've gone through Open Texas Phase 1, 2, and 3. Open Texas Phase 3 lasted for 1 month, ended on June 26th. And for the last 3 months, we've been trying to get COVID under control from Open Texas Phase 3. So now, almost exactly 3 months later, we're going back to an Open Texas Phase 2.5 is what I call it, because it's almost a Phase 3, but bars are still have to be closed unless their food service is greater than their alcohol service. I know I've gone around and seen some of the bars that I like to frequent during normal times, and they seem to be operating. So I'm not sure what kind of effect that has. But anyway, so these numbers are meant to give you an idea of how open we are. So we're not really Open Texas Phase 3 level open, but we're getting there with the new rules that are in place. We'll talk more about that rule later on. There'll be a slide where we can talk about the ins and outs of it. So where are we at right now for transmission? We're at 0.9, the same place we were last week. Both models agree that this is our transmission rate, and what that means is that for every 10 people that get COVID, about 9 additional people get infected from them. We can see that the trend has been slowly increasing over the past month or so, but still generally below 1.0. The map shows you the probability that our transmission rate is below 1. Darker blue means more likely that the transmission rate is below 1. This is the most blue we've seen Texas for a long time, since May. So this is definitely a good development in terms of the transmission rate. Moving forward, for our cumulative number of cases in the coastal Bend area, I want to make some qualifications here. The numbers that we present are for the coastal Bend when I'm presenting them, not for Nueces like when Annette was presenting them. So there's some differences there. I try not to do any overlap between what Annette presented and what I'm presenting. The other thing is we focus just on COVID confirmed cases, and what that means is these cases have been confirmed with a PCR test. So this is kind of the gold standard test for COVID-19. There's also probable cases that we're not including because the rest of Texas has been instructed to only share confirmed cases with the DSHS. And if we want to be able to compare what's happening in Nueces to any other county, including the other 11 counties in the coastal Bend, we need to stick with confirmed cases to be comparing apples to apples. So given that, there's been 23,192 total confirmed cases in the coastal Bend area. And remember, that doesn't include the probable cases that were reported for Nueces earlier, and 22,017 recoveries that we're estimating from that, with 572 active cases. This is about half the number of active cases, give or take, than last week, so we're moving in the right direction. You can see that there's been a little bit of leveling off there now in the active cases. It's not been for a whole week, but maybe for about half a week now, the number of active cases has sort of stabilized. So that might signify the end of the decline in the number of cases that we've been seeing, maybe more of a leveling off in the new cases per day. In terms of our rankings, this is looking very good like it did last week. We're ranked last, second to last in the state of Texas in terms of how many new cases per day per capita we're having over the past week. So this is a good development. We want to be in last place. We want to stay in last place. The only way it could be better is if we just had fewer cases. We're not to the level of cases that we were in May yet. So in May, the week before Labor Day, we had 0 cases one day. It was all single digits that week. So right now, we're still mostly in double digits, so we're not quite there yet. We're maybe at 5 times more cases or so right now than the week before Memorial Day in May. In terms of the 12 counties, these are fit lines or smoother lines fit through the data points, and I kind of hid the data points so that you don't have to see all the mess. But what you can see is we've come a long ways down from the outbreak here, and we're going to zoom in just in the last 2 weeks in the next slide. And you can see that there's a lot of noise. Don't focus on it too much. Basically what you're seeing is that there hasn't been that much change overall over the past week or so. And even over 2 weeks, just about 14 days ago, there were a lot more cases per day in Nueces and in Jim Wells County. I think that is, wait, no, that's Duval, the green line. That's pretty steep on the other side. But for the past week and a half, we've stayed pretty steady. B County has some cases that showed up at the correctional facility there. I saw that on the news last night. So that's not really out in the general community. Another thing here is the vertical lines here, the dashed lines show different phases of open Texas or closed Texas, as you will. And so we've been in this period of limited face-to-face school with about 25% at the Corpus Christi IST. And now next week we'll be able to see what happened after Open Texas 2.5 went into effect. In terms of our percent positive tests, if you look at over the whole scale of the pandemic, how many tests have come back positive for all of Nueces County? 40% of all tests have been positive. Now this includes all of this over here, all of from May, even back into March, up through the present day. And so these numbers overall are skewed because they're really weighted by the time when we had the most tests. And the time when we had the most tests was during the middle of the outbreak. So that's why these numbers are going to come down very slowly. For that same reason, we've been focusing on these other numbers that we estimate what's the percent positives today. And right now we're estimating that the percent positives for all of Nueces is 10%. For the mobile testing stations where we actually know every single negative that comes back also, 10%. And for the public health district testing where we know all the negative cases and positive cases that come back, 4%. Once again, for all of Nueces testing, when you get tested at CVS, we don't figure out who tested negative, we only figure out who tested positive. And so that's why we show all three of these metrics. One of them shows how many positives we had overall. The other ones are maybe more reflective of the actual rate of positivity, even though it's a subset of all the tests. In terms of hospitalizations, and we're following the trajectory of the virus. Once you get infected, it might be 5 days before you're symptomatic, and then maybe another 5 days before you get your test result, and then maybe a few more days before you might get hospitalized if your symptoms are severe enough. And so we're still ranked pretty high in the state of Texas, 5th for number of hospitalizations per capita on average over the past week. So there's been a slow decline in those hospitalizations, and our ranking in the state could be better. When we look at our projection, and this is total hospitalizations that we're looking at here. The green is the projected model. Again, I haven't changed the parameters on this model for about a month and a half. So somewhere around the middle of July, we haven't changed the prediction here. So this has been the same line you've been seeing, and the points just keep falling right along where we projected that they were going to. So this should inspire confidence that we might actually know what we're doing here, and we can project what's going to happen into the future. All the way out to the end of September, the model's still working. So we're at 116 people with COVID in the hospitals right now, and that's 13% of all the patients in the hospital have COVID. Now, there's a few things I want to talk about here. Number one is that this data on the number of patients with COVID, it changes hourly, and I'm sure any doctor will let you know that. Now, that being said, it's not going to change that much hourly. And so the governor has a new policy in place where if this number goes above 15% for 7 days in a row, then what I'm considering Open Texas Phase 2.5 right now, where you can have restaurants at 75% capacity and gyms at 75% capacity. If we have 15% 7 days in a row or more, then we presumably shift back down to Open Texas Phase 1.5, which we have been in for the past 3 months. So if you look very closely, you can see over the past week, there's been a leveling off in the number of hospitalizations. It's no longer declining. I usually wait until we have at least a week of consistent data. So the total number of hospitalizations have leveled off, as have the number of people in the ICU. If you want to split hairs in the past few days, you could say it increased, but I'd say on average, it's stayed about the same. So there's 38 people in the ICU right now in the Coastal Bend area out of 179 total. For the mathematicians in the audience, that's about 22%. That percentage doesn't matter for the law. The only percentage that matters is the total number of people hospitalized, not total number of people hospitalized in the ICU, or percentage of people hospitalized in the ICU. It's important to recognize that the ICU is still stretched above what it would normally be at, and that's because we have this 22% of patients in the ICU being COVID positive. This blue line represents about the average number of people in the ICU normally. When you look back over in May and early June, you can see why that blue line is there, and you can see that where we're at now, we're above that line. It's not that much above. It's 20 more patients. Now, I'm not a public health professional. I can't tell you how many more hours that equates to for nurses and doctors and overtime, or the number of additional staff that they need to maintain those patients, but I do know it's more than is normal. And so this is something that we'd like to see go down even more, and hopefully that'll happen. In terms of fatalities, going along the trajectory of the virus, for those that get hospitalized and maybe have really severe symptoms, some people die. And right now, we're right around the middle of the pack in the state for the number of new fatalities per day over the last 7 days. I want to qualify this. It's over the last 7 days of reliable data. And what I mean by that is the state is counting fatalities based upon death certificates. And they look at the death certificate and they determine whether COVID is written as the primary cause of death or a secondary cause of death. If it's a primary cause of death, the death is classified as a COVID fatality. If it's a secondary cause of death, it's not classified. Now, even though you get reports every day that are more up to date than that from the public health department, and they're using the same criteria, the state is independently going through all the death certificates and counting them themselves. For us to compare ourselves to the rest of the state, and for me to get a Coastal Bend number, I necessarily have to use that data that the state has because I don't get reports on fatalities directly from any other county other than Nueces, just like everybody else in Nueces County. So given all that, we're at 603 fatalities. That's 39 more than we had last week at this time. So 39 more fatalities have accrued over the past week based on counting those death certificates. The leveling off does show you a little bit of reality that there's fewer and fewer fatalities, but at the same time, not all of these death certificates in the black box have been counted yet. And so we expect that there will be some increases. Just like since last week, if you look, the curve will look almost exactly the same, except it's going up a little bit higher. And now we're at 603 instead of 560 or so. And our projection of fatalities looks like this. And then for this goes up to that 14 days ago where we're not sure about the data points here. We got some feedback last week that when we provide this additional data, it makes it look like there's no more fatalities occurring. And so we stopped showing those data points. We'll show the data points as we're sure that all the fatalities have been counted, all the death certificates have been gone through. But you can see that there's a leveling off in the trend there. And we're not plunging towards 0 fatalities per day on average. We're more leveling off above that number. And that's something that we'd really like to see go down more than it is now. So right now we're seeing a slow decline, and the model is fitting that data pretty well. Moving on to cell phones. The reason why we talk about the cell phone data is because it tells us what might happen in the future. And right now, the cell phone data looks pretty good. And the reason why it's telling us about what could happen in the future is because the cell phone data is more indicative of who's getting infected right now. And if you get infected today, you won't test positive most likely until 14 days from now, or maybe 10 days from now. It depends on how fast your test comes back and how fast you show symptoms. So given that, what we see is that there has been a precipitous decline in the encounter rate. And this encounter rate is it's tracking cell phones and where they are, and do they come close to each other. And so the more cell phones that come close to each other, the higher the rate. And what you can see is that since the beginning of remote schooling, the encounter rate has plummeted. And so, and we had an error in the last 2 weeks, vertical line here about when remote schooling started. I was a week off because I looked at the wrong county, so I apologize for that. But now you can see there's a really like a one-to-one relationship between when remote schooling started and when the encounter rate trailed off. I attribute that to parents and children staying at home and being less likely to go out and interact with other people while school's in session. So this is maybe one of the silver linings of remote schooling that we've had. It seems to be directly leading to less transmission of COVID-19 because as this encounter rate declines, so will the transmission rate. We are leveling off now, and so we don't necessarily expect this to decline more, and we do know that schools are going to more and more face-to-face, and so we expect that as that happens, this will start to curve upwards in the future. Last thing, just one more week of this comparing Labor Day weekend to Memorial Day weekend. Labor Day weekend was nothing like Memorial Day weekend when it comes to encounters. There's about half or even less than half the number of encounters on Labor Day weekend, and so a lot less transmission. And Memorial Day weekend, one more time, that was kind of like the beginning of the huge outbreak that we had over the summer. And so that's why we like to compare to that. And if you want one other nice data point, there's Hurricane Hana. This metric works. Nobody really went to too many places during Hurricane Hana. And We'll move on to the next one. For schools, we're starting to see a little bit more increase. You can see for the K through 12, during the remote schooling, we had about the same level of foot traffic in the schools, and now that we transitioned to the limited face-to-face, 25%, you can see an uptick in that. Next week, we'll have 2 data points. This is a weekly average of foot traffic, and so we'll continue to track this. It'll be a few weeks before we're able to see what effect going from 25% to 50% will have. The universities went up, but are now leveled off, and it kind of makes sense. We don't expect the universities to go up much more because they're not going to change their level of face-to-face during the course of the semester. It's baked into the curriculum at the outset of the semester. Junior colleges have leveled off, and technical schools are declining a little bit. Lastly, for essential and non-essential gatherings, it's been a couple weeks since we showed this. There's essentially a leveling off that's occurred across all these categories, with the exception of gaming facilities, which has dropped precipitously. So that's good in terms of there's less likely to be transmission at those sorts of places. And the movie viewership has been slowly creeping upwards. So we'll keep an eye on that, but basically people are still doing more essential than non-essential trips, and there hasn't been much change in that for the past several weeks. So in summary, the Texas-wide outbreak, it's almost over. This is the first time you've heard me say that in 3 months. We had a single-digit day this past week and a single-digit day the week before that. We're not quite to where we were, but we're getting there. Now, the thing that gives me a little bit pause is we're opening up more now, and so we might not be getting all the way there. We'll see what happens. It's kind of up to us and what we do. COVID-19 cases have declined in the coastal bend. Long-term, short-term, they're kind of leveled off. ICU usage and fatalities, they have been declining, but they've started to level off over the past week, so that's something to look at. So we're starting to see a lot of signals that we're at the bottom of the trend, and given the policy changes that are in place, we don't expect it really to go down much more. The ICU is still stretched on average above where it normally would be. The return to remote schooling, again, was correlated with a decline in cell phone encounters, which should also be correlated with a decline in transmission rate. So the silver lining of remote schooling is that. And then our transmission rate is at 0.9. So if 10 people get COVID, an additional 9 people contract it. That's an extinguishing pattern. If we can hold that. If we can't hold it, we're not too far below 1. At 1, we stay the same. If we go above 1, we start to increase. So we need to continue our efforts to reduce transmission to avoid another outbreak. Last thing I want to address is that in our task force meeting this week, I think one of the pressing questions was kind of what's going to happen next? How long would it be before we could tell if something, if we were going into another outbreak? Will the current regulations stop an outbreak from happening? And I ran some scenarios. I'm not going to show a slide from it this week, but it is totally 100% within the realm of possibility that we would get into another outbreak like the one we had over the summer. It's not out of the realm of possibility. How probable is it is up to us. And so if we go back to doing what we were doing at the end of May and the beginning of June, it's starting to become 100% probable that we'll end up in the same scenario that we were in in the middle of June and at the end of June when we went into trying to control that outbreak. If we don't go back to that and we wear our masks and we do the things that we need to do to keep the transmission rate down, we don't necessarily have to get into that big of an outbreak again. If we go above 1, there will be some increases in numbers. That's the way that it is. But if we can continue what we've been doing, it will continue to stay level or decline. So in the end, the ball's in our court as citizens of the coastal bend, and it depends on what we do. So with that, we'll go to a translation, and then we'll take some questions from Facebook.
Las intervenciones no farmacéuticas continúan vigentes con la intención de reducir el riesgo de contagio. En cuanto al radio de transmisión, este continúa en el 0.9, o sea que una persona infectada tiene el 90% de posibilidad de infectar a otra. En el área de la costa, la cual cuenta con 12 condados, se reportan 23.192 casos confirmados por el COVID-19 y 22.017 personas han sido dadas de alta. 572 casos continúan activos, casi la mitad comparada a la semana pasada, lo que es muy buena noticia. A nivel estatal, el área de la costa se encuentra en penúltimo lugar basado en casos nuevos. El porcentaje de pruebas positivas para el condado de Nueces es del 40%. En cuanto a hospitalizaciones debido al COVID, el área de la costa se encuentra en la quinta posición. 116 personas del área se encuentran actualmente hospitalizadas. Las cifras de pacientes en la unidad de cuidados intensivos continúan niveladas, sin aumento o disminución. En cuanto a fallecimientos, estos continúan disminuyendo en el área. Son 603 las personas fallecidas. Resumiendo, el brote de infecciones en el estado casi ha terminado. Los casos positivos en el área de la costa continúan disminuyendo, así como los fallecimientos y las personas en la unidad de cuidados intensivos. Hay un menor número de encuentros entre personas, de acuerdo a los datos por teléfonos celulares, posiblemente por el regreso a clases virtuales. El radio de transmisión es de 0.9. Los esfuerzos por reducir esta transmisión deben de continuar, por lo que se le pide no bajar la guardia.
Dr. Edwards.
Hello, Dr. Bird. Some questions from Facebook users. First question is, has the way of COVID-19 patients identified as COVID-positive patients for the hospital ICU changed?
Can you repeat that question?
Has the way COVID patients identified as COVID-positive patients for the hospital and ICU changed?
Not that I know of. They'll be counted the same way that cases are counted. And so there's confirmed cases and there's probable cases. What I'm presenting are the confirmed cases, and the definition of confirmed is that a PCR nose swab test was given where the RNA of the virus is detected. And a probable positive would be one of the other tests combined with a diagnosis, and that's not what we're using, and it's not, I believe, what the state is using. And I see Annette nodding in agreement, so I feel confident.
And along those same lines, and as far as there's been additional questions about data dumps and how that affects it. So if the data dumps occur and they're sorted out, how do they get put on appropriate days, and does that affect your daily numbers?
Okay, for us in the Coastal Bend, the data dumps certainly affect the numbers that we see. We're informed of how many new cases were reported to the public health department, and that could include dumps. And so you see that on the news, you see it on the websites. In my presentations, I sweep all that change under the rug, and what I'm showing is the data dumps are already reassigned, but they're only reassigned for Nueces County. That's the only county in the state of Texas where we know which dates those cases actually go to. It doesn't really cause us problems unless you don't know which cases are data dumps or not, and you're kind of looking at a number. It can be misleading when you see, like the other day I saw 200, and that sounds like a lot, but then when you find out, oh, most of those were a data dump, then you say, okay, we're in the same place we were at before that. So I think that's the issue with the data dumps, is I think it's hard for the public to figure out what's the actual number is when you get these extra cases dumped on a particular day.
Will you be able to tell when the data dumps start to get smaller numbers? Will you be able to tell that is a data dump, or is that a daily number?
Well, for Nueces County, we know what's data dumps and what's not. We're told that explicitly. And by we're, I mean the public health department, not me. And then they share that information. For other counties, I think the smaller the dumps get, the harder it is to know that it was a data dump. But then the less effect that it has also. But we know that a couple weeks ago, we had a huge data dump for the rest of the Coastal Bend. And we could see that, there was just a big spike, and we could tell it was a data dump because of that. It looks like Annette wants to address this also. So I'll let her come up and do that.
So one other part that's important to that is if the state sends us a data dump, like for today, for instance, if they send us a data dump of 40, but they will tell us 20 of them are old, so they're older than the 2 weeks, so they're not active cases anymore. And 20 of those are new. They're from the last couple of days, so they just got tested maybe 4 days ago from the state testing team. So those 20, we would add them to today's number. You'd see them under the health district number. And the other 20 would be added to the Texas Health Trace, the state number for us. So we're still splitting them so we can actually figure out how many cases are current for us today. So if that helps.
Yeah, and while you're still up here, there's a few questions that you may need to help answer as well. So the school cases that are being announced, are they included in the total numbers?
Yes, absolutely. So we have 37 cases that have been reported to us from CCISD, Cal Allen ISD, Toloso ISD, and Flower Bluff. And so they're included in our over 20,000 cases that we have.
And in that same line of questioning, the home students that are infected or have been tested positive, are they included in the school district numbers?
Yes, they are. So if they're having classes through virtual learning, through a Zoom, they're included as well. So of the 37, 34 of them are actually schooling from home, and then 3 of them have actually been at the school for some reason, face-to-face or a sports activity.
And this is probably a question for you, Annette. Is there, if you're not showing symptoms, is there any place in the county to get tested?
If you're not showing symptoms, yes, you can go to the state testing teams, and they're also testing almost daily, and so you could call us and we can give you that number.
Okay. Kind of the last few questions. As we're moving into the fall, cooler weather has been discussed. Is this going to affect the transmission rate?
Yes. Yeah, so the cooler weather should result in an increase in the transmission rate. We don't expect it's going to be a huge increase, but in more northern latitudes, I think I've heard it could be up to a 40% increase, and that's pretty big, but here it shouldn't be as large. But we did detect an unexplainable decline in cases moving from the spring to the summer, other than it was the season, and we expect that that's going to cut against us now moving into the fall. The one thing that has changed in our favor, if you will, is that there's more people that have gotten COVID. And so the more people that have gotten COVID, the lower the transmission rate goes. Eventually, if everybody gets COVID, then the transmission rate is going to be 0. So that's why it works like that. So that's something that could mute somewhat the seasonal effect. And we expect that benefit is 10%. Or somewhere in that realm of vicinity right now. It looks like somewhere around 10% of the coastal bend has been infected with COVID-19, and that's not by going off the 20,000 cases, that's modeling and estimating all the cases that haven't been reported also.
So respiratory viruses normally do better, in the fall, and so we expect the numbers to actually go up because of that, because that's just the way the virus is. It lives better, but also because when people are sick, they're going to be inside their home, but other family members, because it's cold, will also be inside the home. What we want to remind people, though, is that in March, when we started seeing our first COVID cases, family members were not spreading it to other family members. They were so afraid of the virus that they were making sure that they stayed completely separated from the other family members. They tried not to share a restroom. They stayed in one room for the 14 days. And so we're really encouraging more people to continue to do that as we go through the fall, because you really don't want to see households of families all getting COVID-19 because of one family member.
And last question, Annette, is how long are we seeing results get back after being tested?
So for the health district, we're fortunate enough that we still get it the same day. So we test early morning, usually between 6:30 and 7:30 in the morning, and we have results before 5 o'clock. For the state testing teams, we're seeing a 3-4 day turnaround time. So that's really good.
And a lot of the Facebook users are glad to see you back, Dr. Bird.
All right, well, thank you very much.
Thank you. So, any other questions? So that concludes the press conference. Thank you, and we will see you all on Thursday.